Hello, 405. Welcome to Lab 7, Musculoskeletal Fitness Test. For today's lab, our objective is to measure muscular fitness, perform all those tests to measure muscular strength, power, endurance. Also, we'll be doing our flexibility assessments and our range of motion tests. All of that to gather the data and create the exercise program for our client, our lab partner, for the end of the semester. So all of this data that we will collect today will be very useful for us to create the resistance training program, the cardiovascular fitness program, and flexibility for our lab partner for the final lab project. So let's talk about the parameters of performance. I hope you've seen this before. Muscular strength, muscular power, muscular endurance. Muscular strength, that's the maximum amount of effort that a muscle group can exert in a single effort. Okay, so a very good example is the 1 rep max of a deadlift, like in the picture on the top right corner. Right, this is Thor, probably the strongest man alive, doing this maximal effort, right, of exerting force in a single effort that is the 1 rep max of the deadlift, right? He's using his whole body, his whole muscle groups to exerting force and perform that 1 rep max deadlift. Muscular power, that's the ability of muscle groups to exert force at high speeds, right? So this is more at a sub-maximal of the 1 rep max. In order for me to exert as much force as possible with high speed. So for example, that can be the 1 rep max of the snatch. That will be the picture here in the middle. My CrossFit girl doing the 1 rep max of a snatch. Could also be a 1 rep max of a clean or the vertical jump. So this weight is probably not her 1 rep max of a deadlift, right? Or not a 1 rep max of her squat, for the main reason of her needing to bring the barbell overhead as fast as she can and stand up with the barbell and the weight, right? So sub-maximal weight, just so that she can be able to exert a force and lift it at a high speed overhead and stand up. Muscular endurance, this is the ability of a muscle group to perform repeated contractions against a sub-maximal resistance for an extended period of time, right? So key word here is that this exercise is performed, right? Repeated contractions at a sub-maximal resistance for a prolonged period of time. So that could be, 5-minute plank or max number of push-ups, something that I'll be able to, an exercise I'll be able to perform for a prolonged period of time with a sub-maximal resistance. That weight or that resistance that I'm using, I'm able to do it consistently and repeatedly for a long period of time. So for lab, muscular strength, we'll be able to measure it through your maximal voluntary isometric contraction, the hand grip, that's the MBIC. For muscular power, we'll do a long jump. And for muscular endurance, we have multiple tests. One of them will be the squats. Now, let's talk about the specific training outcomes and this repetition maximum continuum. You've probably seen this before in previous classes. Probably if you're taking strength and conditioning, you've seen this table before. This is our repetition ranges where we'll be able to select if we want to improve strength only or muscular endurance only. We have a repetition range and a intensity, percentage of the intensity that will be according to that goal. So let's look at two ends of the spectrum. We have strength training, that will be a low repetition range, as you can see, but the intensity of that for instance, exercise or just the intensity for strength training as my training goal will be very high. Okay, so repetition range is low, but the intensity and the way that we measure that with resistance training is a percentage of 1 rep max. That percentage is going to be very high, right? The reason why is because that intensity, that weight that I put, for instance, on the barbell is going to be very high, right? Very heavy. For instance, the back squat, right? The weight's very high. So consequently, I'm not going to be able to perform as many repetitions as I would if it was at a submaximal weight, right? So that should make sense for strength training. That's very straightforward. Higher intensity, lower repetition range. And on the other side of the spectrum, we have muscular endurance, where the repetition range is very high, up to 15 plus repetitions for a submaximal intensity, right? A low percentage of the 1 rep max. So the weight in this instance is going to be fairly low or moderate, and I'll be able, that weight is going to allow me to perform it for a prolonged period of time for multiple repetitions up to 15 reps. Now we have here in the middle, there's a spectrum here for hypertrophy training. The literature used to suggest that you could achieve hypertrophy within this rep range, 8 to 12 repetitions max at a moderate weight. But now more research is emerging where it's suggesting that you can achieve hypertrophy on any of these repetition ranges, right? So 3 repetitions, 4 or 5 repetitions, even up to 15 plus repetitions, right? You can achieve hypertrophy that's, increasing in muscle mass at any of the repetition ranges. And so as long as the intensity is high enough that allows for that physiological adaptation, right? For my muscles to experience that physiological stress that would allow for hypertrophy, for my muscles to go under repair, right? And then grow. So you can achieve hypertrophy in the lower repetition range, high repetition range, or right here in the middle, as long as the intensity is high enough that allows for that physiological stress. Now let's talk about muscular fitness and health-related outcomes. For apparently healthy individuals, the focus is on improving or maintaining the following important health-related fitness characteristics. So, very important, right? With resistance training, we know that there's an improvement in fat-free mass, right? Muscle mass, and resting metabolic rate. That's very important for weight management, right? If we have more muscle mass, we're usually going to have higher resting metabolic rate, and that is going to allow me to maintain my weight and maybe lose weight easier or maintain my weight easier as I age. Right, so very important. Resistance training also improves bone mass, right? Which we know that over time, as we age, we lose bone density. So this is very important. It's very related to osteoporosis, right? So resistance training is very good for improving bone density, that bone mass. Also muscle mass, right? Makes sense. And this is related to sarcopenia. Similar, as we age, we lose muscle mass. That's sarcopenia. So it's very important to maintain muscle mass. Also glucose tolerance, which is pertinent in both the pre-diabetic and diabetic state, right? We know that resistance training is awesome because there is an independent pathway where I can uptake glucose and use it for energy for my working muscles, right? Independent of insulin. So resistance training is awesome for glucose tolerance. Also for muscular tendons musculotendinous integrity, that's related to a lower risk of injury, including low back pain, and the ability to carry out activities of daily living, which is so important, right? If I help my client build muscle, they'll be strong, they'll be able to carry out daily activities of daily living, even as they're older, like this lady right here, crushing it. And so this is related to the perceived quality of life, right, and self-efficiency, among other indicators of mental health, which is important. And here are some factors affecting muscular fitness. And I won't go over them in a lot of detail because it's a little bit out of the scope of this lab. We'll mostly be focusing on the practicality of muscular fitness assessments, but this is important for you to know. These are all the factors that can affect the muscular strength and power, like age, muscle size, dietary factors, muscle fiber types, neural factors, social factors, pharmacological agents, right? Hormonal factors, psychological factors, type of training, gender, and heredity. Now let's talk about flexibility. Flexibility is the ability of muscles, tendons, and connective tissue to lengthen as the joint flexes and extends. And so flexibility is determined by the shape of the bones. Right? If you have a longer femur, shorter femur, the cartilage in the joint, and the length of muscles and ligaments that cross that joint. So we know that with increased levels of flexibility, some of the benefits are the increased range of motion, and we can possibly reduce the risk of injury, right? That's a good benefit. For example, this guy, right? He has a good range of motion and flexibility, so he can pull this off, right? Do not try this at home, but he can pull this off because he has the flexibility and range of motion to do the splits while he's holding a barbell overhead, right? So that's one benefit. He has that ability, so it's not gonna be, he's not at a high risk for injury. However, there are risks with high levels of flexibility, right? It can render a joint hypermobile and may increase the risk of injury. So, for instance, if, you know, for the sake of this example, if he continues to do this over time, and he doesn't allow for his body to recover, or he does this so much over time that it may render the joint hypermobile, right? And it can put him at an increased risk of injury. So we have to be mindful about this benefit and risk for high levels of flexibility. So the goal of the flexibility program is to improve range of motion in major muscle and tendon groups, right? Like the shoulder, the hip, the knee, the trunk. So it's very important to include some sort of flexibility on our strength training program, because it improves range of motion and flexibility, and you can see immediate improvements immediately after stretching, right? From the first couple of times that you do the stretch, you might feel very stiff, not very flexible, and then as the time goes by, you performing that stretch, you feel better and better. You can go further into the stretch. And you can see chronic improvements, right? Chronic over time that are going to be able to improve if you consistently do your flexibility over 3 to 4 weeks. You can see chronic improvements if you're training 2 to 3 times per week. That's the ACSM recommendation. And we have two different types, two different styles of flexibility stretching: static and dynamic. Static flexibility, there's no movement, right? You're just holding that stretch like you usually do when you stretch your hamstrings or your quad. Do a quad stretch, static, no movement. And this is recommended usually stretching after exercise. Main reason why is because Static flexibility training before may result in short-term decreases in performance, so maybe short-term decrease in muscular strength and power. But it depends, right? It depends on the athlete, and if your goal is to improve range of motion before a squat, maybe you do some sort of mix between dynamic and static flexibility so that you can perform the exercise the most optimal way without decreasing the performance. Usually you want to do static flexibility after the training session because you're nice and warm, your muscles are warm and ready to perform that stretch and hold that stretch for a prolonged period of time. Dynamic flexibility, this is where there is some sort of movement included in that stretch and in that joint. So for example, arm circles, leg swings, lunges, even like simple body weight squats, where you are improving that range of motion and there is a rate of torque across the range of motion. And this one, it's highly recommended to perform before lifting or before your training session so that you are in an optimal range of motion to perform all the tests or all the muscular fitness tests or to perform the exercise. And so that is one thing that I want you to do before performing the muscular fitness test in lab. Now let's talk a little bit about range of motion, which is very closely related to flexibility. ROM is how far a joint can flex and extend in any direction, right? And the flexibility of soft tissues around the joint affects your range of motion. Joint and muscle flexibility naturally declines as we age, but injury, disease, and surgery or inactivity may also contribute to impaired range of motion. So you see this a lot, right, with clients or people that have had, fortunately, an injury at the knee or the hip, or they had a surgery in the knee or the hip, and you see a drastic change in their range of motion. So we have to be mindful about these things and how to help them with flexibility exercises, dynamic, static, or active, passive movements or range of motion to help them get into that exercise, that position safely and getting the most out of that exercise. And slowly improve the range of motion back again to what it used to be. So you have active range of motion. You actively use your muscles to move a body part, contracting and relaxing muscles without assistance. And you have passive range of motion, where you rely solely on an outside force, like a physical therapist or a continuous passive motion machine. So for this lab, you're going to be measuring range of motion at different major joints, and you'll be performing passive range of motion. You can help each other out and figure out where your true range of motion is for those specific joints, but you're mostly going to be assisting each other into those tests. So you mostly be performing it passively, or you are letting your lab partner perform the range of motion tests on that joint. So a little bit about range of motion and hypertrophy. So you know the significance of range of motion with resistance training or muscular fitness. Research suggests that performing resistance training through a full ROM confers beneficial effects on hypertrophy of the lower body musculature when compared with training with a partial range of motion, right? So if you are performing exercises, for instance, for this systematic review, they found that you performing a full range of motion squat you see beneficial effects on hypertrophy compared to if you did just partial range of motion. However, at least for the quadriceps and based on the interpretation of the data, evidence implies that these benefits are apparent only up to a certain ROM threshold, with advantageous effects attenuating beyond the given threshold, right? So you won't see any further beneficial effects on hypertrophy if you can do for instance, a squat at a further higher range of motion. As long as you're hitting that range of motion for that exercise, you'll see beneficial effects on hypertrophy. Any further ROMs after that, they did not find beyond beneficial effects. All right, so this is the experiment's overview. Please perform a warm-up before performing all the following muscular fitness tests. Do a little warm-up and then dynamic stretching, and then move on in the following order. But it's okay if you go out of order, so you can find a station that's empty and you could perform the test with your lab partner. So if muscular test, please use the data sheet and fill it out. We'll use it for 2 weeks for the muscular fitness test and the skill related fitness test. So please save it, don't lose it. We'll be using it for 2 weeks in a row. Also for today, you're going to be doing the range of motion measurements, right? For the range of motion of the shoulder, the elbow, the hip, knee, and ankle dorsiflexion and plantar flexion. You're only going to be doing flexion only and the right side of the body only. I have made a couple notes in red on your data sheet on things that you can leave out, so you don't have to fill those things on your data sheet. For the hand grip test, right, you're going to measure strength in the forearm using the hand grip dynamometer. Please take a look at your own time, your own pace at the procedures and what you're going to be doing for this test. We're going to be doing a push-up test to determine the muscular endurance of the upper body. For instance, the pectoralis major, anterior deltoid, and triceps. And so for men, the standard down position is going to be a full push-up. For females, it's going to be the modified knee push-up position. And please read the procedures at your own time. For the partial curl-up test, you're going to have 2 lines. It's going to be tape measure on the ground, where you'll be able to place your heels on one line and your hips on the other line. And you're going to crunch up to touch the second line and crunch back down to the first line, just like in this picture here. For this test, you're going to be following along a metronome that's 40 beats per minute. So you're going to be crunching up, down, up, and down at the metronome beat. If you cannot maintain the cadence, right, or loose form, you stop the test and you record the number of crunches. If you complete a total of 75 for men and a total for 70 for women, and you don't feel tired, you can stop up to that range. That would be the maximum rating. Excellent for musculature endurance of the abdominal muscles. For the YMCA bench press, this is to evaluate the upper body muscular endurance, and you're also going to be following a metronome to a cadence of 60 beats per minute for the bench press. So it's going to be for females, the barbell 35 pounds, and for men at 80 pounds. You're going to be following that metronome at 60 beats per minute when you go down, up at that beat, Right? Each beat will represent either the up or down movement, beat, beat, up, down. And the termination of the test is if you're unable to reach full extension of the elbow and if you break cadence and cannot keep up with the pace, right? And the score will be the total number of repetitions. For squats to fatigue, this is for lower body muscular endurance, right? And you're gonna have a chair right behind you so you can get to that 90 degrees range of motion for the squat. You're going to count as many as you can do of squats. You don't have to follow a metronome for this. You just complete as many squats as you can, for as long as it takes. If you complete 49 repetitions for men and 43 repetitions for women, you can stop there. That'll be the maximal rating. For the wall squat test, the goal is to measure isometric length strength or the ability of your legs to hold a contraction over time, right? This is isometric contraction of the lower body muscle groups. So this, you'll hold the wall sit for as long as you can, and you'll record the time. For the medicine ball put test, you're going to be sitting back at a 45-degree angle on a bench press. You're going to keep your back and your head on the bench the entire time, and you're going to throw a medicine ball forward, and the score will be the distance that the medicine ball traveled, and the first time that it lands on the ground, that will be the measurement recorded. The standing long jump, this is for lower body muscular power, and you're going to be jumping as far as you can. And the score will be the distance traveled. The back scratch for shoulder flexibility, you're going to perform both sides for left shoulder and right shoulder. In this example, this is going to be the right shoulder. You're going to be measuring the distance of overlap or gap between the fingers. So in this example here in the top right, you're going to measure this overlap or gap. So the distance in centimeters, measure this distance. If it's a gap, it's going to be a negative score. And if it's an overlap, you measure the distance is going to be a positive score. And so you repeat this for a couple of trials, testing both right and left arms, and you'll record that value on your data sheet. For ranges of motion, you're going to be using a goniometer, and you're going to be positioning it at the joint of its starting position, and you're going to identify the center of the joint's axis of rotation. Then you're going to locate the proximal and distal landmarks running parallel to the joint's axis of rotation, and you're going to align the fulcrum of the goniometer over the joint axis. Okay, so this is the goniometer. You have the fulcrum or axis of rotation, that is the center piece right here. You have the stationary arm, that's the portion of the goniometer that extends from and is part of the protractor. That the protractor measures the area of the motion in degrees. So full circle goniometers are a 360 degrees protractor. You have 360 degrees. Then you have your the stationary arm here, and you have your movement arm, the portion of the goniometer that moves independently from the protractor and around an arc formed by the fulcrum. So I have detailed instructions on your lab manual. Please take a look at them so you know exactly where to place the fulcrum, the axis of rotation, where you place the stationary arm, and where you place the movement arm, where you'll be able to record the measurements. Also on this slide, I provided you with videos that are a minute, 2 minutes long, very short, but very, they're very good. It's detailed instructions and visual representations on how to perform the range of motion test. So please take a look at them at your own pace if you want more information, details on how to perform all of these assessments. So again, please measure just flexion only of the shoulder, elbow, hip, knee, and ankle dorsiflexion and plantar flexion, and just on the right side of the body. And that's it. For this lab 7, you're going to submit the data sheet just with the measurements that we're performing this week. And you can leave blank those boxes where we have all the other different tests for next week. It's going to be our agility, speed, and balance test. So you submit the lab 7 data sheet, and you'll submit the lab manual, the results section, with lab partner information, the analysis of the muscular fitness test, flexibility and range of motion, and you'll answer the discussion questions on the lab manual. Now again, you'll submit the data sheet, the completed data from this week, and the lab 7 manual. Please answer the discussion questions in paragraph form and with complete sentences, and answer all parts to the question for full credit. Thank you, everyone. Happy studying.